Hi, everyone. Thank you for joining us for our question and answer session. My name is Sam Walker, and I'm an Outreach and Education Advisor and will be today's moderator. We are here today to discuss and answer common questions we receive about our allied health programs. Mohawk College specializes in health and offers a wide range of programming, from diplomas to degrees. And today we are here to answer all of your program and industry related questions. Today joining me, we have Laura Thomas, Associate Dean, Allied Health Programs. Thank you for joining us today, Laura.
You're welcome, Sam. Thanks for having me.
We have a lot of great questions for you, so let's get started. Laura, we often get asked about the difference between a pharmacy assistant and a pharmacy technician. Can you describe the differences for us?
Yeah, sure. So the difference between a pharmacy technician and a community pharmacy assistant is a pharmacy technician is a regulated healthcare professional. They're the ones who are compounding the medications. They are putting the medications together for the patients, and they're also describing and explaining how the people are supposed to take the medications. And they'll work in long-term care facilities, they'll work in hospitals, as well as Shoppers Drug Mart. The community pharmacy assistant works with the pharmacy technician, as well as working with the pharmacist to support the patient's needs and education.
That's great. Can you describe what graduates of the pharmacy technician program would do in the workplace?
So with the pharmacy technician, they would be compounding those medications, working directly with the pharmacist on and working with the prescriber of the medications to ensure that the patient is receiving the proper dosage, has proper education, and understands how to take that medication.
Great. Now, can you tell us what our cardiovascular technology students experience in the program?
The cardiovascular technologist program, or CVT as we call it, is a very comprehensive program with lots of hands-on skills education. Students will learn how to do ECGs, they'll learn how to perform Holter monitoring and understand what that Holter monitoring, the results are sharing. They will learn all about sort of exercise testing, different things like that, anything to do with the heart and testing with the heart. Is what they'll learn. They'll understand all of the different devices that are used to support the heart. Again, a very comprehensive program with lots and lots of education.
That's great. Now, can you speak to some of the clinical experiences students will receive in this program?
They will work in different labs, like cardiovascular labs. They'll work in hospitals, clinics where they're monitoring patients' progress after having heart surgery or heart attacks. The CVT students will work as students in the clinical environment, as well as once they graduate, they'll have the opportunity to work in all kinds of different areas. Sometimes our students will work in sales or applications where they'll help deliver education about the different devices.
That's great. So for the types of career options that graduates have, it seems like there's a wide range. Are there a lot of specific niches to where students will go after?
No, for the most part, when it comes to CVT, students often start in the hospital or working in a clinic facility so that they'll get their education and understand what maybe where their passions lie in that field, and then they'll move on from there.
That's great. Now, can you explain to us the difference between an occupational therapist assistant and a physiotherapist assistant and why it's a combined program?
So it's a combined program because often these two areas tend to work quite closely together. So an occupational therapy assistant is somebody who's going to work with an occupational therapist. And the occupational therapist is usually somebody who is looking at devices, looking at assistive devices to support somebody in their home environment, looking at ways people can manage with disabilities and different things to support them in their day-to-day lives. So the occupational therapy assistant will work directly with them to integrate that. Whereas with physiotherapy assistant, they are working directly with the physiotherapist to help somebody in a recovery, in the actual sort of, if they've had an injury perhaps, in the actual recovery or the strengthening of the muscles, working on gait for people who have had problems with maybe a stroke or something along those lines. And as you can see, there's a lot of overlap between these two areas. So the occupational therapy assistant or physiotherapy assistant, the OTA PTA program, allows for some diversity in where that student would choose to go on to work.
That's great. Can you provide examples of places OTAs and PTAs can find employment opportunities?
Yeah, there's lots of options out there. So of course we recognize that, any sort of rehab clinics, things like that would be a classic place for people to be working. But other places are long-term care facilities, sports centers. They could be working in jails, like working with prisoners. They can be working in hospitals, obviously. There's any type of rehab clinics, things like that. There's so many different options. And it's interesting to see as the profession grows and the knowledge base increases, the opportunities increase for our students as well.
That's great. Our diagnostic cardiac sonography is a very popular program that is always oversubscribed. Can you tell us what this program prepares graduates for?
So diagnostic cardiac sonography is a program that is specific to sort of a postgraduate student. This program teaches students how to do ultrasounds of the heart. And it helps them to understand the anatomy, the physiology, and pathologies of the heart for both adult and pediatric patients. So it prepares them to work in a hospital, in an echo lab. They can also work in cardiac labs. They can work in the OR. There's lots of different avenues for the diagnostic cardiac sonographer.
And we offer a medical radiation science program in partnership with McMaster University. Can you describe what the students learn in the unique streams that are offered?
For sure. So there are 3 streams within this program, and that's X-ray or radiography, ultrasound, or sometimes called sonography, and radiation therapy. The way it works is McMaster accepts our students, and for the first year it's a common year, and we have a few courses within that common year that allow for the students to get a bit of an understanding of what the professions look like and how do they align with different personality types. So at the end of the first year, students will choose which stream they want to go into, move into that stream, and start to sort of move through with students specific to that stream for the second, third, and fourth year. Things to know about that program are that it is 10 semesters. There are 3 clinical placements across the area. Usually we try and keep students close to home, but sometimes we have students moving, out of town to go to do their clinical placement. And it's a fantastic career.
That's great. Lots of hands-on opportunities.
Mm-hmm.
Some of the career opportunities that are available to students from this degree program?
Yeah. So working, of course, in hospitals, in any of the 3 professions, radiation therapy, radiography, or ultrasound. In all of those professions, we also have students who go on to work in sales, who go on to work in applications where they come in and teach people how to use the equipment, and research. The labs that we have at the IAHS campus for medical radiation science are state of the art. They are similar to what you would find in a hospital, so it's a fantastic opportunity to get some hands-on knowledge even before they're out into the clinical world.
That's great. Are you able to provide details on the employment success our graduates find upon graduation from our allied health programs?
Usually it's quite good. We have we monitor it quite closely based on the fact that it is very important to us that our students who graduate have opportunities out there. So if we feel that the market is starting to get saturated, we'll decrease our enrollment. And on the other side of that, when we feel that the market is starting to get sort of low, then we'll increase our enrollment to allow for students to get out there into the community. It does fluctuate over the years, but for the most part, we see a very, very high level. Anywhere from 80 to 100% of our graduates will be employed.
That's great. Now, a lot of these opportunities, do they come from the clinical placements that students participate in during their studies?
Yeah, for sure. I always recommend to students when they're asking questions about their clinical placements that they make their sort of home location, the hospital or the clinic or the pharmacy that's close to their home, their last clinical placement, because usually they're at their best. They're ready to start their career, so it's a great time to get in there. And it is very important that our students recognize that when they walk into a clinical placement, that's essentially a job interview in any case. Students have the opportunity to prove their abilities when they're in there as a student in a clinical environment.
Great advice for all of our health students.
Mm-hmm.
If the allied health programs require specific licensing or formal registration before a graduate can pursue employment opportunities?
Yeah, most of them do. It's kind of interesting you can do a little bit of research about the profession before you you look into them. But most of the programs that we're discussing either have national board exams at the end of their program. So we will finish teaching, we will do our final exams, and then the students prepare for national board exams, which are governed by external sources. So you have governing bodies that are either Ontario based or Canadian governing bodies that issue these national exams. And then the students pay for, as they move through their career, to maintain their registration and their liability insurance through these companies as well.
We often receive inquiries as to what programs our international students are eligible to apply to. We know from the applied health sector, they're able to apply to cardiovascular technology, occupational therapy assistant / physiotherapy assistant, pharmacy technician, Canadian healthcare for foreign trained professionals, as well as our community pharmacist assistant programs. Laura, can you provide more information about our Canadian healthcare for foreign trained professionals program?
Yeah, absolutely. The Canadian healthcare for foreign trained professionals is just that. It's a program that's designed to educate foreign trained professionals on our healthcare system. So we see pharmacists and medical doctors from other countries come to take that program, and it allows them some insight and understanding of what it would take to get licensed in our country, or different opportunities for them with their background education.
Can you provide details around the experiential learning students will receive in this program?
Yeah, they are often placed at different hospitals to support different areas. They can maybe be placed at charity organizations in the community. We try and find different opportunities for them to network and connect with professionals in their field. And each year it's sort of a different selection of opportunities.
We also offer our community pharmacist assistant program. Can you provide more information around this?
Yeah, this is a new program that will launch in the fall of 2021, where we'll take international students, and those international students will be paralleled with the students in the community or the Canadian healthcare for foreign trained professionals, where in the first semester, so that they'll have some basic understanding of the Canadian healthcare system. In the second semester, the CPA, or Community Pharmacy Assistant, international students will connect with domestic students that are being brought in the winter semester. So they'll have the opportunity to network with the domestic group as well, and have some understanding of the Community Pharmacy Assistant. At the end of that program, they'll have 1 year of Community Pharmacy Assistant. They'll have one final semester where they again look at networking and understanding the Canadian business section, and having a little bit more information across that provides a bit more of a full spectrum of education.
Thank you, Laura, for taking the time today and answering our questions. You oversee a lot of exciting programs, and we encourage our viewers to visit mohawkcollege.ca/health to learn more. If you are an international student interested in attending Mohawk College, please be sure to connect with our International Student Department. You can visit their website at www.mohawkcollege.international-students, or by email at intl.representatives@mohawkcollege.ca. As an advisor, our team is here to assist you on your academic journey. You can reach out to us if you're considering applying through discover@mohawkcollege.ca. Once again, thanks for joining us today, and have a great day.